When you get your tonsils and adenoids out, this is a surgery that takes about 30 minutes to do. I usually come right out and talk to the family after we're done, so stay around or at least give us your number if you're going to go anywhere. When you get your tonsils and adenoids out, there's primarily two things that I worry about after tonsillectomy that you need to look out for. The first is bleeding. Some people bleed when they get their tonsils out. It usually happens about 1 week later when the scabs fall off. Just when you think somebody's getting better, that's when they bleed, anywhere from 5 to 10 days after surgery. If you do bleed, it's not a little bit of bleeding. It's not blood mixed with saliva or streaked in saliva. These patients cough up clots. It's like having a bloody nose out your mouth. It drips usually out your mouth. If it's a child and they swallow the blood, they'll usually vomit the blood, which makes it even look like more bleeding. If somebody does bleed, bring them into the emergency room. Most bleeding just stops on its own, and we usually don't have to do anything about it, but sometimes it does not, and we have to stop it. So if you bleed, come in. So looking out for bleeding is very important. Most bleeding also happens at nighttime, so if you have a small child, I always recommend that you keep them in a place where you can hear them for the first 10 days or so after surgery, whether that means in an adjoining room or in your bedroom. Besides bleeding, the other concern that I have is narcotic use. Narcotics help reduce pain, and they're needed after tonsillectomies, but narcotics have a lot of problems. They can be very dangerous. Narcotics reduce the desire to breathe, and so people who are sensitive to narcotics, much like alcohol, can become very sedated. Some of them can stop breathing, and this can result in death from aspiration or from asphyxiation. So when you give narcotics, it's important to recognize that they are dangerous and give them in the smallest quantity possible and increase the dose just if you need to. You can always add the additional pain medicine prescribed if you need to, but always try to go with less. Secondly, don't give pain medication in the middle of the night. You would not have somebody who was really drunk on alcohol wake them up and pour alcohol in their throat and then put them right back to bed. This would be very dangerous, and narcotics are the same way. You don't want to wake somebody up, give them a narcotic, and then have them go right back to sleep. And it's not a good idea to give somebody narcotics unless you're able to assess in the next hour or two how sedated they are. So you have to always be aware and mindful of the sedation and dangers of narcotics. I like using ibuprofen and Tylenol. Using ibuprofen can reduce the amount of narcotics that somebody needs. When you use ibuprofen, you can use ibuprofen every 6 hours, and you can actually use Tylenol every 6 hours and do those around the clock. You can even stagger them so that you're using ibuprofen and then Tylenol, ibuprofen, and that way every 3 hours they're getting a pain medicine. The narcotics have Tylenol in them, so you can't use them with Tylenol, but you could use the narcotic instead of Tylenol. So Tylenol, ibuprofen, Lortab, ibuprofen, and just rotate that narcotic into the schedule as you need to. So look out for bleeding, look out for narcotic use. Things that are good to use after tonsillectomy: soft cold things like popsicles are really helpful, things that are easy to swallow. I don't care what you eat, but soft cold things are helpful. Soups, mashed potatoes, applesauce, these are preferable to dry bread and things like steak. So soft cold things are good. Humidifiers help. Using humidifiers, moistening your throat, really helps your throat feel better. Pain's always worse in the morning, and that has to do with the dryness. Most bleeding that occurs actually happens in the night because of the dryness. So run a humidifier if you can. Typically people have several medicines when they go home. They have the narcotic, then they have a numbing sucker. The suckers you should have received from the compounding pharmacy. You want to lick those a couple of times until you get the desired effect, and then put it in the refrigerator so you can use it multiple times. That way you don't go through them too quickly. So you'll have the pain medicine the suckers, and nausea medicine in case of pain medicine makes you nauseated. We usually do not give antibiotics. They're usually not needed after tonsillectomies. It's normal to run a low-grade fever to 100, 101. That's just from healing from tonsillectomy. If the person has a fever above 102, then we typically like you to bring them into the emergency room or call us. After surgery, I usually do not need to see people unless there's been some kind of problem or question. With tonsils, as long as they've healed and are doing well, then that's good enough and you don't need to come to my office. So, things to look out for in summary: narcotics, look out for bleeding, which can happen 5 to 10 days out. Give them lots of soft cold things. Use humidifiers, that's helpful. Use the pain medicine along with ibuprofen and Tylenol. Use the nausea medicine if the pain medicine makes you nauseated. Use the suckers. And come into the emergency room if you have any questions or concerns. Or call us.